Hello, everyone. This is Dr. Bob Gabbay, Chief Scientific Officer for the American Diabetes Association. And welcome to Dialogue with ADA. And today's topic is a really important one. What you need to know about diabetes and kidney disease. And, you know, this topic is so important because, as you'll learn more, the number one cause for severe kidney disease and need for dialysis is diabetes. And sadly, that's not changed. But the good news is there's so much that can be done to prevent kidney damage, and we'll talk about that as well. Uh, it's really because of this that the American Diabetes Association has really been driving a kidney health initiative and working with partners that you'll meet today, one of which is DaVita, a really wonderful partner in this effort. Um, and so we're going to have two speakers, and I'm going to have them introduce themselves in a moment. But one of the things that's going to be fun is that we're going to get the perspective of the healthcare professional, but we're also going to get the real life story of someone living with diabetes and get their impression. And we hope through all of that, you come out with a better understanding of the connection between diabetes and kidney disease, and most importantly, what you can do and spreading the word to your loved ones to maintain good kidney health. So I'm going to start. Tina, can you introduce yourself to the audience?
Sure, thank you. As you mentioned, my name is Tina Livaudais, and I am currently the Chief Nursing Officer for DaVita. I am a registered nurse and have spent really my lifetime and career working in kidney care. I've been with DaVita for more than 27 years. And really have dedicated my life's work to ensure that I'm able to contribute just really meaningful in the care of patients with kidney disease and also participate in events like this where we're able to educate other patients around delaying the progression. So super excited to be here and thanks for inviting me.
Great, and great to have you, Tina. And then Tiffany, you are an amazing woman as we've come to know you. So please introduce yourself and tell a little bit about yourself.
Well, thank you for that intro. No, my name is Tiffani Martin. I've had type 1 juvenile diabetes almost going on 30 years. I'm almost telling my age. I am a recent kidney recipient. This would actually have been my second one. And when I was 27, I lost my sight as well as my kidney function, and that started me on my kidney journey. And so now I am all about advocacy and sharing light on my story to prevent anybody, as much as I can, with sharing from enduring what I and my loved ones had to go through with my health journey.
Yeah, thank you, Tiffany, for sharing that, and your story, as we'll continue to hear on this, is inspiring, and your courage is really wonderful. So let's jump right into it, and for the audience, put your questions in the chat because we've got some questions already that we want to cover, but we'd love to answer yours as well. So, Tina, let's start with the basics. So, what is chronic kidney disease?
Sure, this is a great question, and I think I will definitely start with the basics and not make any assumptions here. So let me just start by saying and sharing what do the kidneys do.
Yes.
So the kidneys, when functioning properly, help our body filter waste and excess fluid from our blood, and it's removed from our blood and it passes from the body through urination. And so, what CKD is, or otherwise known as chronic kidney disease, is a gradual loss of that function or gradual damage to the kidneys, which could in reality take many years to progress. But what happens is the kidney function slowly declines. And so that inability of a healthy kidney to process the fluid and the waste from your bloodstream really fails. And so that can result in a buildup of excess waste, fluid, electrolytes that really can make you unhealthy, right? And if it continues to fail, can lead to a need for dialysis. And as you mentioned earlier, Dr. Gabbay, I think this discussion really is just so relevant for this audience because, as we know, diabetes is the leading indicator for kidney failure. And so I think it's important for this audience in particular to understand that they are at risk for CKD or chronic kidney disease in general. And there is a lot of actions that you can take to help prevent that. And it's just also why I'm excited about DaVita's relationship with ADA to help create this awareness for patients who are living with diabetes and ultimately help them prevent CKD.
Thanks, Tina. Yeah, really, we want people to know more so that they can do the things to ensure that they have good kidney health. And thanks for describing what the kidneys do and CKD. We'll use CKD for the rest of this chronic kidney disease, just easier to say. So, Tiffani, tell us a little bit about your CKD diagnosis. Like, what was it like? When did you find out that you had CKD?
So what I noticed, I was at work and I had noticed I was very lethargic. And then I started kind of gaining this weight that I couldn't really account for and realized I was retaining a lot of fluid. So it was a lot of puffiness. There was, I noticed a lack of urination. And it got to a point to where the best way I can describe it was just kind of drowning without being underwater. It was a lot of coughing, a lot of fluid in the lungs. So when we went to the doctors, what they did is released all the fluid through various, techniques and methods, to try to get that under control. And kind of before we knew it, I was on, PT, peritoneal dialysis. They had implanted the tube, and after that, it was immediately going to DaVita, which I would say going through all of, that life change and that turmoil in such a small span of time, the nurse, and I'll never forget her, her name was Retina. She was an incredible resource and support throughout the entire ordeal, educating us on, what to do next, educating my parents, providing support, to both of them on how to function, within in that space through everything. So it was a whirlwind, and it was really for me an emotional time experiencing it with the people that I love, because it was also a life change, a life altering event for them as well. Going from this normal lifestyle into they're becoming nurses overnight, and just kind of that weight of what was happening to me and feeling it experienced through everyone else. It took a toll mentally, just as much as it did physically. So.
Well, thanks for sharing that. And it sounds like it was a lot to absorb, uh, and it sounds like you didn't even realize you had kidney issues,
No,
or that there. Yeah.
no, to be honest, I was visiting my sister in Colorado, and I kind of took it to like the altitude of the air thinning out, and I'm like, well, maybe it's that, and maybe it's jet lag, and maybe I just need to go walk or drink more water, which was counteractive to everything. And it wasn't until I flew from Denver to New York to go on a date with who now is my husband, that I
Love that.
realized, yeah, I realized as soon as he picked me up from the airport, I immediately fell asleep. And he was, are you okay? And I'm like, I didn't really know what was happening at the time, but my body was starting to shut down. And it was just very noticeable as I was just trying to maneuver and navigate, life as you would day to day. And it was very obvious that something was wrong
Mhm.
during those traveling times.
Yeah. And so Tina, like how you know we heard about some of the symptoms that
Mhm.
can develop, and then how common is it for people not to know that they have kidney disease?
Yeah, it's actually pretty common. So Tiffany's story is not unusual.
Yeah, right.
The yeah, the signs and symptoms for CKD are just really gradual and really subtle, and so they're very easy to miss. And I'll just share just a couple of them. And Tiffany, you did a great job of explaining a couple that you experienced. I mean, definitely a lack of energy, being lethargic is one. Sometimes patients might experience kind of a metallic taste in their mouth, or what some people refer to as kind of ammonia breath. Sometimes there's nausea and vomiting, a general lack of appetite. Tiffany mentioned about kind of shortness of breath and the swelling that can potentially accompany that. I often refer to this as the pillow test. So sometimes you can see a change in the number of pillows that you need to sleep. The more pillows, if you're having difficulty breathing, the more pillows you're going to add. So you're sitting up as you're sleeping through the night. That could be potentially a symptom. And then Tiffany referred to this as well, but a change in urination could also potentially be a sign or a symptom. So it could be, either urinating more, urinating less frequently, foaming in your urine, blood in your urine could be a possibility. So all of those things are things that you would want to watch for. But again, I will just iterate that it's gradual and they're extremely subtle, so they're very easy to miss. And so thinking about a patient who has diabetes or someone who has diabetes, the probably most important action to take would be to get tested annually by your
Yes.
physician, because that is going to be your indicator to whether or not you're progressing towards kidney disease, in the missing of potential signs and symptoms.
Yeah, that's a really good, important point, Tina. So there are a bunch of signs and symptoms, but they really don't happen until pretty late, like
Yes,
Mhm.
pretty advanced, like your kidneys are functioning at a really low level, and then it's can be challenging to do much at that point. Uh,
exactly.
at the same time, a simple blood and urine test will tell you right away.
Hmm.
So it's not hard to figure out whether someone has kidney disease. It's just getting tested,
Exactly. Yep.
and that's why the recommendations, are to at least yearly to be tested and to talk to your healthcare professional about that. So we've heard a little bit of what kidney disease is and CKD is, and how we might not realize it till you're pretty far along, and that you can diagnose it early. So, what can you do to prevent kidney disease? And maybe Tina, if you want to share a little bit of
Hmm.
some ideas.
Yeah, I think first and foremost, we just mentioned this, but I think it's extremely important that you're under the care of a physician and that you are screened every single year via a urine through a urine or a blood test. So definitely stay under the advisement of your physician. I think one of the things that is probably the most simple thing to do is to ensure that you're taking your medications as prescribed, both your diabetes and your blood pressure medication. We talked earlier about diabetes being one of the leading indicators or causes for kidney failure, and that's because high blood sugar levels as well as high blood pressure really damage the vessels in the kidney, which could then lead to continued damage and ultimately to the progression towards failure, which is what we're talking about. And so you should definitely ensure that you're taking your medications as prescribed by your doctor to make sure that you're keeping your blood sugar as well as your blood pressure under control to limit that damage. And then I also would recommend that you understand your risk level for kidney disease. And we are, have been working with the ADA, and you can go to the diabetes.org or as well as DaVita.com. And we have developed just a 60-second kind of questionnaire that you can complete that will give you an understanding of your risk as it relates to CKD and kidney failure. And so I would encourage you that you visit those websites and take those quizzes. And then I think, again, most importantly is to advocate for yourself with your physicians around getting screened annually for chronic kidney disease.
You hit on all sorts of great things. I'm just going to hammer them, like get screened every year, blood glucose, blood pressure.
Yeah.
I mean, those three things can make all the difference. Tiffani, in your journey, as you reflect back, what might you have wanted to have known or done differently in all of this?
Differently, and it's kind of why I advocate so much now, in particularly for the African American community. Um, we look at food more so as a comfort and not necessarily energy and fuel. And with that in mind, uh, we tend to uh, lean toward foods that are more, appeasing, to our tummies, as opposed to what they could possibly do to better or prolong, our lifespan.
Mm-hmm.
With that, your fried foods or things that are more heavy and comforting. And so I would have, if I could, um, you know, once I got older, altered, my eating habits.
Mm-hmm.
Just the education now that I have about, certain type of foods, and then also moderation. I know when people become or learn that they're diabetic, they kind of, I can't eat anything, and that's not necessarily true. It's moderation and what you eat.
Mm-hmm.
You can enjoy some things. You just have to work around those things, whether, adjusting your insulin, you know, increasing your work. It's just management more so. Um, Also, the intersectionality that I have between being African American and a woman. On the woman side, it's, we handle our stresses differently, and the stress on our body increases our blood pressure, which ultimately for me did not help the poor management that I had over my diabetes, but also contributed to me losing my eyesight from the high blood pressure, as well as the kidney function. So it's just being mindful of those things that we really just don't don't take into consideration when we're just living. Stress is, oh, it's work, it's normal. No, you might need to take some time, digress, figure out some solutions to bring that blood pressure down. Or, when we're out socializing and eating or, drinking, hey, might need to be a little bit more conscious about what you're putting into your body. Um, because, like Tina mentioned, it's gradual. So you're not going to have the immediate effects of, oh, I'll have this, casual drink here. It won't affect me. I mean, you keep having these casual drinks over, a period of time, they start to stack up. And then before you know it, you're too advanced in renal failure to be able to reverse any of those symptoms. So,
Yeah, no, very, very true. And it's really, again, catching things early, not letting them progress. And the other point that probably the audience should know is that you mentioned the African American community at higher risk for developing high blood pressure and much higher risk of developing kidney disease
mhm.
and higher risk of developing diabetes. So all of these things together really make it that much more important to sort of pay attention, get screened, get tested, and do the right things. If you don't mind, Tiffany, so you tell us a little bit about your experience with getting a kidney transplant.
So the real question is which one?
Yes, right. You actually have had more than one. So yes,
Right.
if you want to just briefly, tell people a little bit what's involved, and then I'm going to ask Tina a little bit to tell us, like, you know, who can get a kidney transplant and that kind of stuff.
So, leading up to it, there's a lot of testing. There's a lot of blood work. One thing that I focused on rather, is my sister became vegan a couple years ago, right after I got diagnosed with kidney disease. And so I kind of, I like to say I'm vegan adjacent. So took a lot of her, her cooking tips and, how she went about it and applied it to what I was eating. So I kept my weight, uh, you know, I kept in good shape, all things considered. I walked and everything because I didn't want any complications with surgery. They check various things, and I'm sure Tina will get into it. But is your body well enough to endure a surgery of that magnitude? And so from there, I got a pancreas and kidney transplant. Which for the pancreas, technically, and I like to do my air quotes, I don't have to take insulin because my the transplanted kidney that I have, transplanted pancreas that I have, is producing insulin, um, and so that kind of limits down my glucose testing as well. Even though I do get that every 2 weeks with my doctor visits and whatnot. Um, I got that the first kidney from a cadaver, and uh, historically, they don't last as long as a living donor. And so from that, that was done in June of 2017. I got married in January of 2019, and I started seeing rejection around that time. And by um, August of 2020, we noticed the signs March of 2019, but by August of 2020, I was back on dialysis. And I just, as of May 17th of this year, received a kidney from one of my best friends. And so I am doing all that I can to take care of this kidney. And even though I'm no longer, quote unquote, diabetic per se, I still function as though I am. So I'm not, even though I'm not, eating sweets like crazy. All I drink is water and medicine balls from Starbucks. I don't really put anything. I stay clear away from sodas. But I pretty much still function as though I was a diabetic because I don't want to return back. So
Yeah,
that's
it sounds like
kind
you're extra careful. So Tina, yeah, who's eligible for a kidney transplant, and you know,
Yeah. Yeah, I would love first just to reiterate that with proper management, patients can really delay CKD to
yes,
prevent to the point of needing dialysis or transplant. So that's the number one message, is manage your
Yes.
care and do all the things that we've been talking about, so you don't get to the place where you would be posed with such a question. And then obviously these discussions should happen with your healthcare providers and your physician. But in general, what we would love to see are patients receive what we call preemptive transplant. So they're able to be transplanted before they have a need for dialysis or another form of renal replacement therapy. And so there are many patients that are great candidates for transplants. And Tiffani spoke about the ability to get both a pancreatic transplant as well as a kidney transplant, which would be ideal. But there are some contraindications for those with to receive a transplant. And so that might be like presence of a malignancy or another type of cancer, an active infection. So might prohibit a transplant until that is resolved. Drug and alcohol dependency is a consideration. And then even at times, obesity or is another consideration that we would need to think about as an active plan. But in general, kidney transplants absolutely create a better quality of life and are more favorable in terms of not only quality of life, but survival statistics as it relates to dialysis. And so I would just encourage you again to have these conversations with your physician. You have an absolute right when you get to the point of needing this referral, but you have an absolute right to a referral to a transplant center, and so and to a nephrologist early. And so I would engage in those conversations with your doctors so you can be evaluated for a transplant option. And if for some reason you're not ready, then working with that healthcare team to develop a plan around obesity or whatever else it may be that you could actively work on for you to progress to be eligible for a transplant over time.
Great. So people should consider the option of transplant if they are at that point. And again, the big message here is that all of this is potentially preventable. And so one of the questions that came out in the chat were, we mentioned that you could do screening for kidney disease. People are concerned maybe they have kidney disease and they don't even know it. So what should they ask for?
Yeah, I think two things that I would encourage you to ask for. One is a simple urine test that assesses what's called albumin or protein presence in your urine. So if that is positive, that's abnormal and can indicate that you might have some kidney damage. The second is a blood test, and it's called a GFR, which calculates your glomerular filtration rate, which is inside of your kidneys, and that's the filter, so to speak, that kind of eliminates the waste and fluids that we talked about earlier in the call. And so it's a simple blood test that will give you a number to your doctor as it relates to how your kidney is functioning. And it will tell them when, in fact, you might be progressing to kidney disease and ultimately kidney failure. And then there are associated actions that should take during that time, like a referral to a nephrologist, a referral to a transplant center, as we've been discussing.
Yep. So a urine for protein and GFR, and you can get those pretty much anywhere.
Yes.
Like every lab does these tests. They're not unusual. Yeah.
That's
So
correct.
if you have diabetes and you haven't had those tests done, you should definitely ask for it. Time is like we're moving really quickly here. This has been a great conversation. So we haven't been able to cover everything. So Tina, resources, if people want to learn more, they want more support, they have more questions. We couldn't get to them all today, but maybe we'll do this again sometime. Where can they
Yeah,
go?
for sure. And I know we're almost out of time. So really quickly, diabetes.org, absolutely. And I think it's diabetes.org/kidney is your resource that includes both DaVita, so renal information plus diabetic information. So definitely that's number one. Number two is you can also visit DaVita.com, which has a lot of resources there as well that's readily available for you to find additional resources as it relates to dietary needs as well as kidney community education classes.
Great. So there's lots of information out there. Go to reliable sources like the ones you described. We'll throw those into the comments, and I think we need to wrap up here. So maybe I'll ask each of you for sort of a final thought to share with the audience. So we'll start with you, Tiffany, and then we'll let you. Yeah.
For the most part, don't look at diabetes as just something that's impeding on your life. Just look at it as another managed opportunity. Just as you would change your lifestyle to a healthy one in order, like working out or what foods, keto diet, all of those things. Just think of it as another component just to maintain your life and just find ways to incorporate it and not look so much at it as something that's impeding on who you are and what you want to do. It's manageable. You can beat it. You do not have to end up like I did, being blind, going through 2 transplants, 2 types of dialysis, affecting my loved ones. It's completely preventable.
And thanks for your service to the community to tell your story. Tina, final words.
I think Tiffany said it all. I would just reiterate that this is completely manageable and preventable. And so my one word of advice, I guess, would be get smart about your risk factors, the actions, as we've been discussing, that you can take to prevent progression to CKD, and use the resources around you. They're really abundant, and so take advantage of that to help you kind of navigate your path forward.
Great. And reminder, diabetes.org/kidney. You should see in the comments section for more information. This has been ADA Dialogue. Thank you both for joining us. Thank the audience. And we will be posting this. So if a loved one or friend that you think would benefit from this program, share it. And again, see you all next time. Thanks, everyone.